Hi, this is Appy talking to you from Healthcare Link. So our team have just returned from having some great dialogues with practice managers that we've met at the AAPM conference in Canberra last week. Speaking to them, we had some interesting points come up, and particularly we were focusing on the pain points that they may feel in recruiting healthcare professionals into their practices. One of the sectors that we picked up on and had further dialogues on was on the practice nurses and specialist nurses for their clinics. So, of course, we all understand the importance of the practice nurse or the clinical nurse. They really are the pillars of strength and support in the practice. So when they're going about their hiring, what we heard was that they would sometimes put a local ad in the newspaper to try to get sort of people living in the community or in the surrounding areas. Sometimes they may go to the local health networks. As a last resort, they might spend a little bit more money on generic job boards and still not quite attract the right kind of candidate for local talent. So our team talked to them about how Healthcare Link and how our platform can support them, and how when you raise the job with us, you are able to put in the ARPA registration that you need, focus on the Australian residency details and really narrow down the pool to try to get maybe a smaller but a more relevant list suitable for their clinic. We also talked to them about some other options that they could think of when they are shortlisting. So we've asked them to think about maybe broadening their candidate pool by looking at the hospital-based nurses. There are quite a number of nurses that we speak to who are looking to make that shift or transition into general practice or private practices. It could be the hearing centre or some sort of a skin cancer clinic, for example, but they're quite willing to make that shift. And talking to them, it does involve a bit of a screening process on your part, but there are a few people who are quite capable and willing to learn the practices involved in a medical centre as opposed to the hospital. So there's an option there. You could look at that and see if that will help you broaden your pool. I hope that helps. So if you have any questions, give us a buzz and we'll be happy to help you out. This is Appy talking to you from Healthcare Link.